right now, when people check in, they can see us on the timelines and the groups that these are on. So these are on some chambers, some community groups, and there's also business owners sector, and some of the invitees that we have. And this will be available for download and to watch even after the show.
Oh,
So
great.
if they missed it, they can click on the link. They will still see it. If they scroll down my timeline, the chambers timeline, they can still do it. So people, I still get questions from the interviews that I have from the past. And, we can just kind of do a messenger thing. Hey, there's a question. I think it's, something that we should respond to or something like that. But yeah,
Sure.
it's available, and I can also send you a copy of the broadcast in your timeline, so
Yeah, sure, great. Thank you. Yeah.
Yeah, this is episode 3 so far. I've had interviews with a chemist, a scientist, and it was a fun conversation because you mentioned in one of your materials that you sent to me that zinc was a good way to fight it, and she mentioned that scientifically.
Oh, good.
So yeah, exactly. She was really telling people to go get it, and it will really help support the immune system, especially at this time. A lot of the questions was there going to be a maximum dose, or it's really safe to just take it daily?
I think it's just safe to take it daily, as if you get a bottle of zinc, and you can take what's directed on the bottle.
Yeah,
I wouldn't overdose on it, but I think it's safe to take.
I want to overdosing, but we just want them to have something that's that will keep them healthy, especially nowadays. I've had people also still doing walks and going to the mall, even if the mall's closed. Would that be safe? Now, I mean, they should just stay home, I think. Right?
I think that people should go outside and walk. I think they should walk alone, and if they see somebody else, they should stay about 6 feet away. I think it's really healthy to be outside walking. One of the things they've found with this is that vitamin D is good, and sunlight promotes vitamin D. So it is really important to be outside and walking. I think it also helps with people who might become a little depressed from staying inside.
Mm-hmm.
But I'm all for being outside and walking. I don't think any malls are open, are they, at this point?
They're not open, but like just walking the hallway.
Yeah. So I don't know if I'd walk inside.
Yeah. Well, I'm just concerned if they be touching things, so they should be just washing their hands when that happens.
Mm-hmm.
See on your sidebar there, Dawn is saying hello. Dawn Springborn.
Oh. Hi, Dawn. How are you? Good to see you.
Yeah, she's been very busy. She's doing ACLS and BLS right now. So that's really helpful because people, the nurses and doctors needs to be updated on their ACLS, especially like end of the. I used to teach BLS, so at the end of the month you'll get like a whole ton of phone calls because they can't work the next day on the 1st of the month if they don't have BLS.
Right, they need it.
Yeah. So, what else is there? Are you still riding horses?
Yes, I still ride horses.
I have a picture of you here. Look at that.
Oh, did you get that from Facebook?
Yes, I did.
Okay.
I follow you
Yeah.
on Facebook. So, yeah. Have you still been riding after all this?
So I have actually, and one of my horses is at my friend's house. So my friend has a stable at her home in Ontario, and I can still go there because it's not closed. It's not a public facility. She only has about 5 horses there, and they belong to herself and one of my horses. So I have been lucky enough to still get to ride and get outside. And in fact, I did ride this morning, so it's been a good stress relief.
So that's what you do to take your mind off of things, right?
Yes. I'm happy to be able to do something.
How long are your shifts?
We're working anywhere from 8 to about 9 or 10 hours these days. Yeah.
Wow. And are the ER still staffed well right now? I mean, they're making sure that everybody is having all the help they can get, all the resources are available.
Yes, we have plenty of staff. Our patient volumes have gone down a little bit because I think people are staying home. They're listening to the shelter in place and social distancing. But we have plenty of staff there. We have plenty of nurses and plenty of doctors and lab techs and all the ancillary staff. So I think we're fully equipped to take care of people.
Nice, nice. So I think some people are already watching us right now. So let's start with a little bit about you. Who's Dr. Blasco? I mean, I know you, but
So I am a board certified emergency medicine physician. I've actually been practicing clinically. This will be my 22nd year practicing. I did my residency at UC Irvine and graduated and then worked at Kaiser from 1998 up until 2014. Currently, I work at Riverside Community Hospital. We're a big facility. We're one of the highest volume facilities in Southern California, located in Riverside. And 3 years ago, we started a emergency medicine residency program. So now we have emergency medicine residents that we teach. And I am part of the core clinical faculty associated with UC Riverside.
that's awesome for them to get somebody like you to teach them what a large scope of expertise. And
Yeah.
for everybody here, the way I know Dr. Blasco is, I don't know if you guys know that I was a nurse in my past life. I was a nurse for 19 years, and I work in the emergency department. So you can only imagine what it is right now in this period of time where there's this a big pandemic going on. I've never imagined that we are going to be going through something like this in my lifetime, but it's
No.
a different world. It's a different world. And I wish, part of me wished that I was still there, but a part of me says I think I have a different mission now that I'm doing what I'm doing right now. So a part of my service is bringing people that have the knowledge up front to make sure that we have factual information, because there's so many information in the social media that people are just putting out there that are not fact-based. So it's creating more panic than helping. So I thank you so much for coming through to our interview and sharing your information and your expertise, because you've mentioned to me that you've been doing podcasts also regarding and following this for a couple of weeks now, right? Tell us.
Yeah, I have. Well, I do ride horses, and I was asked by somebody who's actually based out of the UK, the United Kingdom, to do a weekly podcast, and I've sort of become his featured Dr. Rider. We get on every week and we have discussions about how this started and how things change, and what's truth and what's a myth, and how can we educate people. And I'm really glad to be here today with you, because I agree for sure there's a lot of things being discussed on social media and in the news, and sometimes what's truth and what's not truth is hard to dispel. So
Yes. So being in the ER, I kind of wanted to start with just giving us a mental picture of what happens if somebody comes in symptomatic and we have high suspicion that this person is in fact carrying the virus.
Sure. So when somebody comes in, we pretty much classify them as a person of interest, or somebody that really doesn't have any risk factors for the virus, for COVID. If we suspect they are possibly infected, we have them put on a mask. Actually, everybody that comes to the hospital right now is getting a mask. So when you come in and check in, if you're suspected or not, you do get a mask, which is nice. The patients that have a fever or a cough or any respiratory symptoms that we suspect might have COVID, we do put a mask on them, and we put them in areas that are isolated from other patients that we are not suspicious of. So they're going into rooms that have what's called negative pressure, which means that the air is filtered out and not circulated to other rooms. Those patients are wearing masks, and they're definitely being put in areas where they're not exposed to other people. So we start that right away from when somebody comes in.
And I had an unfortunate member of a family that passed away in a hospital with COVID. So it was such a disheartening thing to know that they're not able to see family members after. They're just sent directly to the morgue and to crematory. Is that true here as
Yeah,
well?
it's very unfortunate right now. We are limiting visitors. Certainly, if there's a situation where somebody needs a family member or needs an interpreter, we are making some exceptions. But in general, we are not letting visitors come in. And the main reason for that is because there's a lot of people that are asymptomatic, and they might have COVID, and we might not know it. And we just really want to limit the exposure to everybody at this point in time.
So the non-COVID uh, person of interest versus the COVID person of interest, are they have separate areas in the ER and separate set of nursing staff?
We have separate nursing staff. We have separate areas for the patients. And at Riverside Community, we've devised a method of seeing patients through a video interface. So we're back basically practicing some telemedicine within the emergency department, where the patient, kind of like what we're doing right now, it would be like you and I. And if I was the patient or you were the patient, I would introduce myself on the video. I can see the patient through the video. I can make an assessment. I can order tests, and then reevaluate the patient without actually having to go into the room and see them. Now, that being said, if someone's critically ill or needs a procedure or needs some critical intervention, like a breathing tube or something, we're there in the room with them.
That's good. That's good. How about they're telling us that the healthcare professionals are now in short supply of PPEs. Is that true?
Personally, I have not experienced that. I work right now at Riverside Community and a little part-time at Corona Regional, and I haven't noticed that to be a problem. I feel protected when I'm at work. I feel like I have all the equipment to stay safe. And I think that's something, that's been a little propagated. I can't speak for the whole country. I'm sure there's areas where people might have a different scenario, but where I am, I think everybody has what they need to stay safe.
We have a question from Dawn Springborn. She's also a registered nurse here. She said she has another friend that is an RN in a medical floor. Her hospital is canceling nursing shifts and closing these floors. He's confused. Why would this type of thing happen when all the resources are needed? And is the volume of patients not as large as reported in the news? Do you know if this practice at all hospitals? I think you can see that from your screen as well too.
Yeah, I can read it. So yeah, I can speak to that a little bit. So the main thing is that all elective procedures have been canceled, and there's a high percent of people that come to the hospital for elective type procedures. And all those things have been shut down. So, for instance, if someone has a scheduled colonoscopy or a scheduled removal of some mass on their body that's not critical, those people aren't getting admitted to the hospital. The other thing that we've noticed is that our ER volumes are down because people are staying home. They're not coming to the hospital for as many things as they would come before COVID started. So right now, we're trying to conserve our resources. California is predicting that our volumes are going to go up over the next few weeks. So I think that right now we're trying to keep people, healthcare workers especially, safe and not exposed. And so yes, volumes are down, and there are some nursing shifts and even doctor shifts that are being canceled right now because the overall volume is lower.
Wow, so they're canceling shift instead of putting more people. But I guess it depends on the volume that's coming through the doors, right?
Right.
Yeah. So I also I wanted to know about the difference of this flu versus the other flu, because I know we've just went through a flu season, and
Sure.
sort of a time frame. Can you agree with this? That people are saying a couple of months, 3 months, maybe 18 months. What, in your own personal opinion, what time frame are we looking at for all the curve to flatten per se?
So just to discuss your first question, it is different than a regular flu in the sense that although it is a virus, like influenza, it's a different type of virus. The coronavirus is actually named after, because it looks like it's a circle and it has these things on it that look like a crown. So it's a different type of virus, and it has an affinity to attach the lung, and it can cause very, very bad pneumonia, which is different than regular influenza. Also, influenza has been around a long, long time. A lot of people have had influenza, and if you get influenza once, you can get a different strain, but it's not usually as serious. So this is a very new virus that people haven't had, and that's why it's causing a higher mortality rate than the flu per se.
So
Go ahead.
sorry, I didn't mean to interrupt, but does the virus just like the lung area?
It does. It likes the lungs, and it causes a lot of lung destruction. And we're seeing people develop pretty serious pneumonias that we haven't had to deal with from a medical perspective in the past.
How about after they recover? Does it leave a permanent scar in the lung tissues?
It's a little too early to tell that, because we're just seeing our first patients who have recovered. I think they'll probably do some studies on it. But I would hope that the lungs would recover fully, and that people who ended up developing pneumonia will have no problems in the future. I think it's a little too early to tell that, though.
Would there be more significant scar tissue damage if the person was a smoker or a vapor? Then
yes. So smokers and vapors tend to have pre-existing lung damage, and that can make them at a much higher risk for developing very serious pneumonia, and even dying from this. Vaping lung injury is a problem in and of itself. I personally believe that vaping is very, very dangerous and can cause significant damage to the lungs. So people that vape and smoke have a higher risk of getting a bad pneumonia and not recovering.
how about that question about the time frame? What are you thinking?
How long is this going to take? I wish I had a crystal ball. What we're seeing right now, though, is it's promising in the sense that people have respected social distancing. I just read a report even from New York City today, which is kind of the hardest hit state, is that the curve is kind of what's called flattening. So it's not rising anymore. It's getting to the point where we're not getting multiple new cases every day. We're not having many people die every day. So I think that we're seeing the social distancing effect is limiting the spread. I think Trump was optimistic. He wanted things reopened by Easter, which is next week. Today is Palm Sunday, but next week is Easter. I wish we could say, yeah, it will be open, but I think California definitely is mandatorily closed until the beginning of May. I'm really hoping it doesn't extend much through that. The warmer weather is coming, and that's good, because it tends to limit the spread of viruses. So as we get into the warmer months, I'm hoping that this will become manageable, and we'll be able to go back to our lives.
So after they recover, what days, or what's the period of time we're in they consider no longer infectious?
So what we're recommending is a 14-day quarantine. So if anyone does get diagnosed with COVID, we're recommending 14 days of quarantine, and then going back to regular activity, with the caveat that you have to be completely symptom-free. So if after 14 days you're still coughing, or you have a fever, or you don't feel well, then we would extend the recommendation for self-quarantine.
So we are really looking at social distancing being a big part of lowering down the infectious process, right?
Yes.
How about the use of the face covering or the mask? Because I think now it's becoming to be a norm that if you leave your home, you need to be wearing some sort of a face covering. I
think it's a good idea. It's definitely not going to hurt. obviously if you're out at Target or at the store, you want to be staying away from other people at least 6 feet. But, if you were out at the store and you were staying away from somebody and they sneezed or they coughed forcefully, if you had a face mask on, I think that would protect you even more. I don't know if they can make it like mandatory that you have to wear a mask. I think they can.
LA County.
I'm sorry, what?
It is mandatory in LA County.
Wow.
Yeah.
So what's happening if you don't wear a mask? Are you arrested or?
I have a friend who works for the LAPD, and they are making arrests, or at least for a moment, they are leaving people with just a little slap on the wrist for now. But if you continuously doing it, and if you have intent, that you're not really heeding the guidelines, then they can give you either a fine or a little bit of detainment time. So that's what I've been doing. Yeah. And if you're reckless and say you're just, out on the street, just wandering, they're also giving you those types of punishment. And they reported several underage, like 17 and below, doing this because they think that they can challenge it. And they know I'm immune, I'm young, but you see younger people in the year coming in with the same symptoms.
Yes, and the problem with younger people is that they might have a very mild illness or maybe even have no symptoms at all. And that's great for them because they're not sick. But if they come into contact with somebody who's immune compromised or elderly or has diabetes or underlying lung problems, they can be the ones that get the other person sick.
Yeah, good point. Because they don't know if they're carriers or not. Here's another question from Dawn. What do you know about treating COVID with a hydrochloroquine?
So they are looking at that drug, and they've done some research actually from New York City where they've had the worst cases, and they're finding that it does help the recovery. It hasn't been something we're using from the get-go, and I think also there's some limited supplies, but it has been a drug that's been shown to improve recovery. It's definitely not going to prevent it, but I think it's a promising drug.
Is that a prescription drug? Because I've heard that there was a death because people were consuming it without doctors' recommendation.
It's actually a drug we use to treat malaria, and I'm not quite sure where you could get it. But yeah, I definitely wouldn't take it without a prescription or a doctor's recommendation.
Yeah. So there's a question again regarding the temperature. We've kind of talked about it earlier, but what temperature kills the virus, or do we know that the higher temperature definitely controls it?
I'm not really actually sure the answer to that question. I can certainly look it up, but I'm not 100% sure. We do know that UV light has been shown to kill it, and there's some mask sanitizing we can sanitize masks with UV light, but in terms of a temperature, I don't really know.
Okay. What about the vaccine? How far away from getting that?
So any vaccine does take a lot of time. A few weeks back, they started actually at Kaiser in Seattle looking at a clinical trial for vaccines. And now, with the developments over the past few weeks, there's vaccine companies out of Germany and in Europe that are looking at vaccines. It really takes about 12 to 18 months to get a vaccine that would be safe to be administered to people. So it is definitely about a year away. I think they're going to be working on it, and I think it's something we will probably see become a vaccine that is available to people in the future.
That's good to know. I mean, hopefully, we're praying for that vaccine to come out sooner rather than later. There's a question because going to the stores is considered part of the essentials. So she's you see that question, right? Can we get the virus from the food that we buy from the store or fast food?
So in terms of it being on food, if you're thinking about produce, I would definitely recommend washing produce. They haven't really said that it can live on, vegetables or fruits. In terms of it being on, plastic, I don't know. I go to the store and I buy my groceries. I don't come home and disinfect them. So I don't think that that's been something that people have been too concerned about. One thing, I did go to Target a few days ago and the bags were free. So that was nice. They didn't charge me 10 cents anymore because they couldn't use my bags. So they gave me bags. But I haven't been too worried about getting groceries or things from the store.
How about in the mail? I had a audio recording from our postman that says that we should really be careful about the packages and the mail that comes in through the door. And the recommendation was to leave it for 24, 48 hours before even, handling them. Is that something that you would recommend as well?
So it can live on surfaces for up to about 72 hours. It doesn't live very well on paper surfaces. It tends to live a little bit better on metal. So, I mean, I guess to, take the safest precaution, you could leave your mail for about 24 hours or packages from Amazon for about 24 hours before you touch them. But it doesn't live too well on cloth or paper.
There's a question regarding it being airborne or not. I know that in a hospital setting where we probably do suctioning or some type of a medical procedure, it could become airborne. But in a day-to-day basis outside of the hospital setting, would you think that it would be an airborne type of transmission?
I mean, it's only airborne if someone who has it coughs on you or directly in the air and you pass through that air immediately. The particles, if they're in the air, they're going to go to the ground. They're going to die. It's not like floating around in the air.
You see a question on your sideline that says something about spraying and sanitizing. I'm not really.
Why there's no spraying or sanitizing, like the house of the patient? I don't understand that question completely.
So I guess if it's a recommended practice to have the house sprayed, I'm not sure. But let's have her for Pramanta Station. If you can just maybe clarify that question, we would answer that if we know exactly what you're asking. For the meantime, how about testing? I've only seen a few, maybe one in around the Rolling Hills area here in the South Bay. It's for the testing. And I have a friend who works for a UCLA medical office, and they said that even if you have been in contact with a person that was tested positive, it's still really difficult for them to test everybody. How true is that?
It is very true. We're only in the hospital, for instance, we're really only testing people that are getting admitted. At Riverside Community, we're only testing people that are getting admitted. At Corona, we're testing some specific people that are going home, and those people are also being followed up by infectious disease and public health. Last weekend, there was some testing being done down in Elsinore at one of the stadiums there, where you could fill out a questionnaire online and you could request testing and get tested. The latest from Governor Newsom is that he's trying to get more tests readily available. Right now, there's been about 125,000 out of our 40 million California populace that's been tested. So, a small part. And of those 125,000 that have been tested, there's still about 13,000 people that are waiting for results. So we're not just testing everybody.
Testing. From the testing time to when you get the result, how long is that? I'm getting several different answers. Some of them 10 days, 14, sometimes even longer.
So initially, when we first started testing, it was taking up to 2 weeks. They have gotten testing a lot quicker. So I've seen tests coming back within 48 to 72 hours. It kind of depends on the lab that's running the test and where it's being sent.
Okay, so it all depends on the volume that they get as well too, right?
Yeah, and which lab is running it.
Going back to the hospital setting in the ER, can you please tell them when should they go to the doctor? I'm pretty sure some of us are afraid to even step in the hospital doors, but there are symptoms that we need to have emergency care and urgent care. Can you tell us what those symptoms are that we, even if we're afraid to go in, we should go see the emergency room?
Absolutely. And I'll answer this kind of in twofold. One, if you're suspicious that you have COVID and you're having trouble breathing, chest pain, feel very winded when you walk a few feet, high fevers, vomiting, really bad muscle aches, we want you to come in and be evaluated. Otherwise, routine emergencies, if people are having chest pain, abdominal pain, high fever, symptoms unrelated to COVID, we still want you to come. We don't want you staying home. We've actually been seeing people putting off medical problems and then coming in with complications. Like, for example, people probably know what appendicitis is. It's pain in the right lower abdomen area. It can be associated with vomiting and fever. We've had people ignore those symptoms for days, and then they come in only to find out that their appendix has perforated, which is a very bad complication, which requires a much longer hospital stay than a simple appendicitis that could be diagnosed easily in the first day or two of the symptoms starting.
Yeah, and you will prevent the whole surgery issue, right? Because now you're going to have to be admitted for a surgery to remove
Right.
the. Yeah, and sometimes even after that, if you come late, then you're septic. So now,
right, and then you're in the hospital for a week versus a day. So we want you to be careful about coming to the hospital in the sense that if you have a small cut or something that you think you can deal with at home, we want you to contact your doctor. But if you have something that you really think you need care, we want you to come in. We want you to know that our processes are to keep you safe when you come, and we don't want you to feel scared about coming to the hospital that you're going to get sick.
Yeah, for those who came in, I think a lot more people are on our interview right now. This is Dr. Barbara Blasco. She's an emergency room doctor practicing for over 22 years now. I've had a pleasure working with her when I was a emergency room nurse in Kaiser in Riverside. So yes, I was there, although now I'm in South Bay. But she's one of the doctors that I highly regard and highly respect. So I'm really, really happy that she agreed to be on our interview here for us to get more factual information. I have Debbie Knopf there. You remember Debbie? She says hello.
Hi, Debbie. I know. I saw. Hi, Deb. Yeah.
Yes.
And then, so there was a question. Share with us decontamination routine when you leave work. So for me, I wear a clean pair of scrubs when I go into work. I'm going in soon, and I'm wearing my scrubs now. So I wear a clean pair of scrubs. When I get to work, I put on shoes that I have in my car that I walk into the hospital with. During my shift, I wear a mask. I wear goggles. I plus minus wear hair protection if I'm going to be in a room that's possible contagious person. When I'm done with my shift, I change into either a clean pair of scrubs or clothes that I bring. I walk out to my car, I change my shoes, and then I drive home. And as soon as I come home, I take off my clothes, put them in laundry area, and take a shower. And that's been working pretty well so far.
Yeah, a friend of mine who also works as a nurse, and what she did was kind of have a tent outside her home by her door. She just, yeah, and so a set of clothes that she wants to wear going in the house. So I think we have as a nurse, we have had those in place even before this, because working in the emergency room, you really don't know what you're looking at when you're caring for a person, especially if you're in triage. You get a lot of coughing and everything. I mean, I'm speaking from my experience, and it's been my habit. Even now, I don't wear my outside clothes to the house. They stay in the garage or outside my door. I have a rack for my shoes. It's just no for me to go in, because in my mind, I see the UV lighted bacteria thing that I'm bringing into the house. So I think that even after all this, we would highly recommend that people would still be very vigilant and worry about what they're bringing into their homes. And
Absolutely.
yeah, and even being careful and maybe even practicing not so much, but then still a kind of a social distancing, especially if the person that is around you, you're suspecting that they have cold and cough. Now, going back to that, when people are asymptomatic, say for example, there's a person that is not symptomatic going out to do their essentials, going grocery, and they have their mask on. They have a low chance of transmitting it to other people, right? Especially if they're following the face covering, right?
Absolutely.
And that's
Yeah.
the entire reason why we're doing all this.
Mm-hmm. I mean, there's definitely people that can. I saw a question earlier. It's not on my feed anymore. I can see, but there was a question about, can people have it and have no symptoms? Yes, they can. They can have minimal or no symptoms and still have it. So that's really why we're still very vigilant about the social distancing, and I think the masks are now coming into play.
Yes, and it's really, really helpful now. Wendy says hello, Dr. Blasco.
Wendy, I know. I see everybody on Facebook all the time. So yeah.
It's nice to have sort of a reunion when we do something like this. There is a question from Jay Fish here.
Mm-hmm.
She said something about the coronavirus could become seasonal. What's your opinion, and what to do not to duplicate the dilemmas or the panic that we're having right now?
Sure. I think he's probably right. It could become a seasonal type thing. It won't be as bad even if it does become seasonal. Number one, we'll have developed some immunity. There'll be a certain number of people that have had it, and they'll be immune to it. We are also obviously working highly on a vaccine, which will be helpful. My hope is that this becomes more of like a flu type of illness that is that we treat just like a regular influenza, that we have those outbreaks every single year, and we're not taking all the measures that we are right now.
Now, you may or may not answer or know the answer to this question, but something about this being a terrorist attack. What's your point?
No, I don't believe that this is any sort of terrorist attack. I honestly think if it was, we'd have a little bit more input from the president and politicians. I think this is a real virus that unfortunately is dangerous because it has a high mortality rate and it's very transmissible. But I certainly don't think it's any type of bioterrorism.
Is there something like a herb or a natural remedy for this? Don's mentioned the forsythia or forsythia, I believe. Is there any truth to that?
I can't really speak to that. I'm sure there's probably alternative medicines, but unfortunately, I've been pretty busy reading about all the recommendations, from the CDC and people like Dr. Fossey and people that are, on the front lines. So I imagine that there probably are some, either homeopathic or herbal treatments that might be beneficial.
What are the common supplements that you may recommend for us to be taking so that we will have a boosted immune system good enough to be helping fight off what we have going on right now?
Sure, absolutely. So we talked about it a little bit. Vitamin D has been shown to be helpful, and we get vitamin D when we go out in the sun, and I think a lot of people are staying in. So a vitamin D supplement. Also, zinc has been found to be beneficial. And then very recently, after studies that have come out of New York City, they're finding that vitamin C actually has been administered to people who have been in the hospital and they've had better outcomes. So I think that, zinc, vitamin D, and vitamin C are all things that can help us.
That's awesome. How about the measures that you've already saying about how when you go home, is this something that you also do for yourself to, I'm pretty sure that every day you come into work, you have to make sure that you're ready to face the challenges in front of you. What do you do?
Oh yeah, I'm taking my vitamins, and I also, get outside in the sun as much as I can, and try to stay healthy and try to stay active and doing things that I enjoy. to keep me, with a good mental outlook too.
How about this cold and hot water thing? What can you say on that?
I don't know if there's any real truth. I know that, drinking, hot tea and warm liquids whenever you have a cold actually helps a little bit to keep, the saliva from passing down from the nasal cavity into your esophagus, and it helps to keep things moist. So I think that's the biggest benefit. I don't know about cold making it any worse, honestly.
And this is something that I've been very vocal about. People are looking for N95s and things like that. And I remember as a nurse, we have to be fit tested for that.
Mm-hmm.
So that's
You do.
effective. If you are not fit tested and you're walking around with it, it's just the same as a regular mask or just a face covering, correct?
Correct. And, they really don't recommend a special N95 mask for people in general. A face mask is going to do a good job of protecting you. Also, one of the jobs of the face mask is to protect other people. So if you are sick, wearing a mask protects other people from getting what you might have. There's been a shortage of N95s in some areas of the country, so they're trying to reserve it for healthcare workers. And you do have to be tested so it fits properly. So if you wear a mask that doesn't fit properly, it kind of defeats the purpose.
And it takes away from the people who need it most. That's working in the the hospital setting. There's one question here that may have been a question with a lot of people. Why is it different from the H1N1, the SARS, and the other, the other flu type of problems that we had in the past? Why did we do lockdowns or stay at home then?
So this might be a little confusing, but when they look at viruses and transmissibility, there's something called an R naught, and the R naught means if one person has it, how many other people are going to get infected from that one person. So the easiest way I can explain this is that this virus is very transmissible. And if one person has it, it can be passed on to 2 or 3 people very, very easily versus H1N1 or the regular flu that isn't as transmissible.
So that's why they were more lockdown. It was not as transmissible as the COVID now. Right.
Right. And it also is
more
virulent. Mm-hmm. Yeah, there's a higher mortality rate associated with it. So for, compared to H1N1 or the regular flu, this might kill 2 or 3 people where the other viruses might have a mortality rate of 1 person versus 2 or 3.
I have a question very specific here. He said, how badly would COVID-19 affect someone with hypotropic cardiomyopathy? It's a very specific question, so go ahead and let's go with that.
So that's actually a great question. I don't know if the poster has cardiomyopathy, but what we've found with this virus is that it can cause a cardiomyopathy. So unfortunately, people who are previously healthy can actually die of a cardiomyopathy because of this virus. So I would make the assumption that somebody who has an underlying cardiomyopathy might be more highly infected by it and have a higher mortality rate. So I don't want to scare this person if they do have a cardiomyopathy. But I would definitely caution anybody with any underlying medical problems, even diabetes, high blood pressure, smoking, that they should be very, very careful about not getting exposed to anybody, and they should take a lot of precautions.
That's good to know. Especially, I don't know if the poster has it, but I think it definitely was specific to that question. What measures would you recommend for us now that we know what we know?
I'm sorry, say that one more time.
What recommendations would you give us now? I know that you've been following this from the beginning, so there's been a lot of development since then. So, we're almost at the end of our interview. I've had you here longer than what we wanted, but I just wanted to give you an opportunity to give us recommendations, what we need to do, what we should be observing at this time.
Sure. So definitely, reiterating, following social distancing, I know it's hard to stay home. I don't like to stay home. I love to go to the gym. I can't go to the gym. I saw a couple people posting that they're trying to work out at home, so find some exercise you can do at home. You can go outside and walk, just don't do it in, a crowded area. For sure, if you are sick and you need medical care, please come in and don't be afraid.
That's good. Thank you so much, Dr. Brasso. This has been very informational. I think this has been very juicy. I think we've got a lot of answers.
I'm happy to help.
Yeah, I really am thankful that you, in short notice too, that you were very much willing to share information with us here. This video will be available for people who missed today's show. So if there was any more questions, I'd just go ahead and message you, and maybe we could personally answer those questions to the viewers.
Sure, absolutely. Yeah, thank you for having me. It was great.
And good luck, and please stay safe. We need you to
I will.
continue.
Thank you.
There, and we'll see each other soon.
Okay, thanks a lot.
Thank
Bye-bye.
you for everybody who are in this video. Thank you so much for watching. Please share it. I think that this is going to help a lot of us. And continue to watch our show, and let me know if there's any other comments, suggestions of any topics that you would like for us to go through. Thank you so much, and see you again soon.
Thank you. Take care. Stay safe, everybody.
Bye-bye.
Bye.